Good afternoon, friends. Welcome again to our YouTube channel. Today, I want to discuss with you about pathology. We have already finished with the subject internal medicine, and now all division finished with the exam. Now the only left were in online education. So now let's turn about pathology. So first question comes to our mind: what does it mean pathology? It's very important question. We read the complete subject, and someone comes to us and asks, what does it mean pathology? And our eyes start rotating on the fan's rotation and maybe on fingertips. That's nonsense. So let's continue so that we can overcome such normal problems. So in this pathology, basically, I'm going to tell you about pathological anatomy and what does it mean pathological anatomy. Actually, it is a science which studies, or we can say which deals with the origin, course and outcomes of the disease. Suppose a person is suffering from typhoid fever. What is the origin of this typhoid fever? What was the cause of this typhoid fever? What is the course of this typhoid fever? And what can be the outcomes of this typhoid fever? Whether this typhoid fever can lead to the death of the person or not. These are the outcomes and also complications of the disease. Yes, sometimes the complications of disease favorable and sometimes unfavorable. And in this complete pathology, we will be going to have idea what are the favorables and unfavorable outcomes. So if someone asks you what is the definition of pathological anatomy, so you can say that it is a science which studies the origin, course and outcomes of the disease. Let's have a look again. Or you can say pathological anatomy is a science that studies the structural base of the disease at different level of morphological organization. What does it mean? It means whether it is at cellular level, whether it is at tissue level, whether it is at organism level, organ system level. These are the system morphological organizations. The definition I already gave you this part in introduction. Definition is already written here. You can see that it is a science which deals with origin, cause and outcomes of the disease. But sometimes we know we read the complete pathological anatomy. What can you ask your brain? Why we are studying this subject? What is the necessity to read this subject, to study this subject, and why the teachers present in the pathological anatomy department to teach you? Means there is some importance, and let's have a look. What is the importance? First is the etiology. What does it mean? It means that what is the cause of the pathological process and what are the conditions which are favorable for the development of such disease. Let's have example of typhoid fever. Like typhoid fever, what is the cause of the typhoid fever and which favorable conditions are the medium for the growth of the typhoid fever. Next is pathogenesis. We able to get a simple idea what is the pathogenesis of this disease means mechanism of development of pathological process, how it's developed. And in pathogenesis we have three forms. First is morphogenesis, which means the consistency and developing mechanism of pathological process. Second is cyanogenesis. Cyanogenesis is the recovery mechanism. And last one is thanatogenesis, that is the mechanism of death. Also, we got to know about complications and outcomes. I already told you. We also get to know about morphological pattern by the help of microscope at the microscopic level and by our eyes at the macroscopic level. Also, the knowledge about thanatogenesis and the last evaluation of the functioning and stage of damaged organs. So this is the aims, or you can say these are the objectives. if someone asks you what is the benefit of reading pathological anatomy, so the benefits are we will able to get the etiology, means what is the cause of the disease, pathogenesis, what is the mechanism of development of this disease, and if we know the pathogenesis, then we can know what drug we should give to the patient. Means if we know microbiology and pharmacology, then we can easily understand the pathogenesis of any disease. And complication and outcomes, I already gave you information. Now, what are the methods of pathological anatomy? Actually, we have some methods and materials to study the pathological anatomy. Instead of methods, we also have some materials. Remember, I want to give you this information that we have three methods. We have cadaveric method, we have experimental method, and we have material taken during the patient life. Material taken during the patient life. Why I tell you about this material? Because the next thing that I will deliver to you is biopsy, and biopsy is the part of the materials. And which materials? That materials taken during patient life. You know, you have seen maybe in your family, in your relative, or maybe someone of your friends have sometimes some inflammation, maybe inside the body, maybe outside the body, and it persists for a long time. And then doctor asks for biopsy, and that is the sampling of the tissues or cells that taken from the body during the patient's life, not after and not earlier. Because if we will not have patient, where we will go to take the sample? In the heaven? No, that's not possible. Maybe for you, not for me. Okay, so we now I want to discuss about the methods. You just know the names: microscopic method, macroscopic method, electron microscope, cytochemistry, histochemistry, immunohistochemistry, and molecular biological research methods. So these are the basic methods you must know. Now, the most beautiful topic that I already told you that I will deliver to you it now, that is biopsy. What does it mean, biopsy? Simply, I can say that removal of cells or tissues for examination of any pathological disease is called biopsy. Okay, and in a standard way, we can say that biopsy is a intravital sampling of cells or tissues from the body for the diagnostic, prognostic, or research purpose. So purpose may be diagnostic, we want to diagnose the disease, maybe prognostic, and maybe research purpose. Okay, what are the types of biopsy we know? So we have main three types of biopsy. So the first type is the way of obtaining material. How we are obtaining the material. So we have excisional biopsy, incisional biopsy, needle biopsy, surface biopsy, and scraping. So what is excisional biopsy? Excisional biopsy is the entire lump or suspicious area is removed. Incisional biopsy means only a single tissue or cell is removed. Only a single cell or tissue is removed. Needle biopsy, that is the sampling of tissue or fluid is removed by the help of a needle. By the help of a needle. Then we have surface and scraping. Then we have surface and scraping. Surface and scraping we know very well. And then based on accuracy control, we have classical and target. What does it mean target? Target include endoscopic examination, okay, ultrasound, X-ray guidance, stereotactic biopsy, and according to the urgency, we have two types. The first one is emergency, and the second one is planned. Like operations, emergency operation need emergency treatment, and planned operation can be done after a few days, after a few months, according to the severity. So, according to the operation requirement or the severity of the disease, biopsy are also classified into emergency and planned. Now, I want to give you information about intracellular protein degeneration. This is a very interesting topic, and actually, these come under the category of the dystrophy, and it is the parenchymal protein dystrophy. We also have fat and carbohydrate degeneration, but today, according to the list of the question, the second question is intracellular protein degeneration. So I want to talk with you about only protein degeneration. Okay. So in case of protein degeneration, we have four type of protein degeneration. That is granular, hyaline drop, hydrophic, and keratinous. So first of all, you know that it is a type of dystrophy. But do you know what is the mechanism of formation of dystrophy? What does it mean dystrophy? Okay, so now I will tell you. Dystrophy is a pathological process which is caused by the disturbance of metabolism of our body, which leads to changes in the structure and which leads to damage. So the mechanism of the dystrophy, we have four mechanism. First mechanism is infiltration. The first mechanism is infiltration. What does it mean infiltration? Suppose this is our cell, and in the cell excess blood or lymph start flowing into it. After some time, the cells will not be able to assimilate this product. Another mechanism for this maybe normal incoming of such amounts, but maybe the problem with the cells and the cells is not able to assimilate some and which leads to normal amount of incoming material. The second stage is decomposition. We know inside the cells there are different organelles, and when breakdown of such organelles take place, then we are talking about decomposition. The third stage is piruvated synthesis. What does it mean? It means synthesis of abnormal substance that are not present normally or synthesized normally in our body inside the cells, such as amyloid body, alcoholic hyaline, glycogen by renal epithelium, and keratin epithelium of the lacrimal gland. And the fourth is transformation. We know the meaning of transformation is transformation of something into another thing. For example, protein and fats are transformed into carbohydrate, and carbohydrate transformation takes place into fat and proteins. Now I want to give you information about granular. So the granular is the causes are hypoxia, intoxication, disorder of blood circulation, disorder of lymph circulation. The main thing is that what we can see on the microscope and microscopic level. On the microscopic level, we able to see, suppose this is our cell, we able to see eosinophilic granules in the cytoplasm. And the mitochondria increase in times 2 to 5 times. Why it is increased? It is increased because the mitochondrial matrix expansion take place, and this expansion is due to the expansion in the granular endoplasmic reticulum. And do not confuse, it's simply endoplasmic reticulum, and granules are present on rough endoplasmic reticulum. So we can say in case of granular dystrophy, on the microscope we can see eosinophilic protein in the cytoplasm, and on the high magnification we can see that mitochondria is increased 2 to 5 times in size because in this expansion of the size of rough endoplasmic reticulum. And on the macroscopic level we see cloudy or dull swelling and or cut surface of parenchyma dull and protrude, and myocardium look like cooked meat. While in case of hyaline dystrophy, the etiological factor you can say almost same for all. There are no changes. Majorly you can say intoxication, hypoxia, and enzymopathies. Now the second is the hyaline drop. So in case of hyaline drop, there are no specific changes in case of macroscopic preparation. But on the microscope, here we see hyaline eosinophilic inclusions. And for this we have two examples. One is with kidney and another one is with the liver. So in case of kidney, suppose we have tubules here. These are our tubules. These are. So in case of kidney, what happens? In case of kidney, when this epithelium damaged and rejected, so due to these rejections, hyaline cylinders are formed within the walls of the tubules. Within the walls of the tubules. While in case of alcoholic hepatitis, hepatocyte contains clumps of alcoholic hyaline. Patient drink alcohol and combine with hyaline and form alcoholic hyaline, and that's simply called Mallory bodies. That's simply called Mallory bodies. Now, what is the mechanism of hyaline drop formation? Okay, let's have a look. Suppose we have this chamber, and in this chamber we have coagulation proteins, and we have some solution, and this solution, suppose, lose its hydrophilic properties, and due to these hydrophilic properties our proteins are dispersed phase, and this will precipitate down. This is the mechanism of formation. Main simple mechanism. It will lose its hydrophilic properties, and that is first phase main coagulation proteins. We simply we can say cytoplasmic proteins will coagulate and will precipitate down at the bottom of the vessels or tubule or lumen, whatever way they will be. Next is hydrophic. In case of hydrophic, also there are no specific changes, but in at the microscopic level, what will happen? Suppose this is the cell, and at the microscopic level, what will happen? The cytoplasm volume will increase, and due to cytoplasmic increase in volume, the organelles and the nucleus moves to the periphery, and it resembles shape like a balloon. Shape like a balloon. So this also called balloon degeneration. So balloon degeneration comes under the category of hydrophic or vacuolar dystrophy, that is a part of parenchymal degeneration. And we have some difference between the hyaline and hydrophic. In case of hyaline, there is total or focal coagulative necrosis, and in case of hydrophic, we know hydrophic means water, means more accumulation of fluid, so it will be wet necrosis, means liqueficative total or focal necrosis. The last is keratinous. Please be so kind and listen very carefully. Keratinous means deposition of keratin. This keratin can be deposited either at the right place, means on the squamous epithelium. This condition is called hyperkeratosis or ichthyosis. But sometimes it is located on the abnormal positions, like on oral cavity, cervix, and esophagus. So this condition is called leukoplakia. And leukoplakia condition is very dangerous because sometimes it can be a source of cancer. And it can be due to vitamin insufficiency, maybe patient has some congenital disorders of skin and others. On the macroscopic level, how we will be going to differentiate whether it is leukoplakia and hyperkeratosis. So in case of leukoplakia, there will be there will be rising bands, and maybe patches on the surface of the skin, above the surface of the skin, in the form of on the mucous membrane, in the form of grayish whitish color. Do not confuse, our color is right, but actually the color is grayish whitish. And in case of hyperkeratosis, we able to see the skin become rough and dry, and it resembles like fish scales. While on the microscope, the hyperkeratosis is looks like uneven thickening because there is hyperplasia of the malpighian layer takes place with the thickening of the keratin layer. And in case of leukoplakia is with the desmarcation of scales, that is cancer peels, that can be observed in squamous cell carcinoma. And we know pinkish layer formation resembling PAS. So that all information I want to give you today, and that is nothing, that is a simple slide that I use from the PowerPoint presentation, and that do not belong to them. All presentation was by mine, do not think that is was by me relation or something else. Everything was by mine. Thank you very much for your attention. Have a good day.